talking about effects, we mentioned substance use and abuse. Ted was leading us through that conversation. What are the physiological effects of substance abuse? Let's just be very direct so that people understand what homeless youth are facing.
So, yeah, when we talk about substance abuse, first of all, we should always include alcohol in that conversation. And so we know the long-term effects of alcohol on the liver, on your stomach, issues like that. And so that irritant, it makes you at a higher prevalence for liver disease, ascites, where you're getting that inflamed liver. And then also gastric issues, you start seeing more of like gastric like cancer. And then when we talk about drug use, the most notable would be like IV drug use. And everyone knows that's increased for HIV and AIDS and then hepatitis C.
Wow. Wow. Is it too much of a stretch, gentlemen, for me to say, as you were talking, Aron, it occurred to me that, some of these very specific conditions that we can talk about, alcohol use and abuse, drugs and hypertension and all that, could we equate homelessness with those? Does that word alone need to be enough of a trigger to make us say this is something that needs to be addressed, because homelessness is in fact a risk group in and of itself. The condition of being homeless is as serious a risk group as hypertension, high blood pressure, alcoholism. Too much of a stretch, or yes?
Yeah. I mean, it's not too much of a stretch. It definitely, I feel like the homelessness puts you at an increased risk as a lot of the times you're exposed to the elements, right? And so at extreme times, we look at your blood pressure, or your exposure to, like the sun, exposure to rain, that kind of things. I feel like, those it increase the likelihood of you having fungal infections, rashes, scabies, TB, things like that.
Wow. Evidence shows that having a mental health disorder. This was, as I got ready for this conversation, this was a sobering fact that I learned about. Julio, I'm going to toss this one to you at first, and then everybody kind of chime in. Evidence shows that having a mental health disorder prior to becoming homeless is a predictor of future homelessness, and experiencing homelessness is a predictor of developing a mental health disorder. Ted just bravely told us about having seen a therapist for a while last year when he also experienced homelessness. This strikes me, it might be a chicken and egg conversation. Are the two inextricable? Homelessness leads has a higher probability of leading to mental health disorders. Having a mental health disorder leads to homelessness. My heart just went out when I was pulling up some of that data. Julio, comment on that if you would.
Yeah, I think that there's a big correlation and how it affects either way, right? Unfortunately, we don't live in silos. So whatever is affecting me physically, and I don't have a home, like there's hierarchy of needs. One of them is being housed. So if I'm not housed, I'm going to be in extreme risk of feeling unsafe, and that is going to make me feel the fight or flight, constant stress. So it's going to affect how I behave on a regular basis. And if we add to that there may be substance use, that I'm like, let's say I'm using meth to be able to stay up all night because I don't feel safe, that is going to contribute physiological, psychological, and emotionally to the way I present. So in the future, my options are going to be limited. That may contribute by being able to work and to have more access to resources because of the social stigma. So it's going to make it most likely that I'm going to continue to experience homelessness, which in return is going to contribute to exacerbate the mental health conditions that I'm experiencing.
I see. Any other comments on that before we get to our next question? I've got one for Ted about his own experiences. Anything, Aron, you want to add to that?
So yeah, I definitely think this is a chicken and egg kind of conversation. I really liked what Julio said about siloed experiences. Like these really impact each other. So we know that the mental health will contribute to the higher risk of homelessness, right? And we see that especially in communities of color, where we're not always given those resources. And then also being homeless is a higher risk factor for developing further mental health disorders. So those are the relationships that I see there.